Good afternoon, everyone. I'm Annabel from the Singapore National Eye Centre, and this afternoon I'll be talking about glaucoma management in primary care. So glaucoma is a specific progressive optic neuropathy with characteristic optic disc and visual field changes, and this is often associated with raised intraocular pressure. It is a leading cause of irreversible blindness worldwide. As it is asymptomatic in the early stages, it is often undetected until extensive visual field loss occurs. Hence, it is called the silent thief of sight. Glaucoma blindness is preventable if detected and treated earlier. The number of people with glaucoma in Asia in 2013 was 51.32 million. This is estimated to increase to 80.87 million in 2040 due to the aging population. The prevalence of glaucoma among Singapore population, adults aged 40 years and older, is 3.2%. So patients with glaucoma, early on in the disease, they actually have mild peripheral visual field loss, and most of the times they do not notice it. As the disease progresses, the visual fields becomes more constricted, and in end-stage disease, they often end up with like a tunnel vision. So glaucoma is classified based on the appearance of the angles. In the eye, aqueous is produced by the ciliary body. It goes to the front part of the eye and it drains out from this front portion here called the drainage angles. So primary open-angle glaucoma is the most common form of glaucoma in Singapore. It is when the angles are normal and opened and there's no underlying cause of the glaucoma. Primary angle closure glaucoma is the second most common cause of glaucoma in Singapore. It is when the angles are actually closed, and again, there's no underlying cause. Secondary glaucomas arise secondary to trauma, surgeries, or other ophthalmic disease or systemic conditions. So risk factors for primary open-angle glaucoma include older age. For each decade increase in age, the odds are increased by 50%. High intraocular pressure is a significant risk factor for glaucoma. If there's a positive family history of glaucoma, male gender, myopia, and eyes with longer axial length, if the patient has hypertension, diabetes, as well as other vascular risk factors like lower diastolic blood pressure and lower ocular perfusion pressure. In these conditions, there's actually a decreased blood supply to the optic nerve. Risk factors for primary angle closure glaucoma includes older age. For each decade increase in age, the odds are increased by 118%. High intraocular pressure, family history of angle closure, female gender, East Asian and Inuit ethnicity, hyperopia or short eye, and other ocular factors in which the ocular dimensions are smaller than usual, such as a shallow anterior chamber depth, a thick lens, or thicker iris. So when should you refer patients? If the patient has symptoms and signs suggestive of acute angle closure. Now, acute angle closure is an ophthalmic emergency and the patient should be referred immediately. So the symptoms will include unilateral ocular pain or brow ache that's associated with headache, nausea, and vomiting. The patients may complain of decreased vision with halos. And this may be precipitated by physiological mydriasis. The patients may be watching TV in a dark room. And the symptoms can last for hours or days, or it can be intermittent in nature. Okay, the signs will include an injected eye, hazy cornea, a fixed mid-dilated pupil, and the eye will actually feel hard on palpation. Okay, so Dr. Wu actually went through this just now. By using a pen torch, we can actually see the eclipse sign in patients with narrow angles. Okay, so in an anterior chamber that's very deep, when you shine a pen torch from the temporal aspect of the eye, the entire iris is actually illuminated. Okay? When the anterior chamber is actually very shallow, the iris is vaulted forward, and there will actually be a shadow here seen at the nasal side. Okay, what about chronic glaucoma suspects? So the following patients should be referred. Okay, so patients with high intraocular pressure, okay, if they have a family history of glaucoma, so first-degree relatives will have an increased risk of getting glaucoma by 4 to 9 times. 50% of siblings of patients with angle closure will have narrow angles. patients on long-term steroids. So all forms of steroids can actually cause a rise in the intraocular pressure. So topical steroids can cause a rise in the intraocular pressure within weeks, and systemic steroids within years. 18 to about 38% of the population are known to be steroid responders. So patients with primary open-angle glaucoma, relatives of patients with glaucoma, if the age is more than 40 years old, diabetic patients, and patients with myopia are all at a higher risk of getting a steroid response. If there's an optometrist report saying that the patient is a glaucoma suspect, please refer this patient as well. And if the patients have a suspicious optic disc. So the upper limit of intraocular pressure is 21 millimeters mercury. A value that's higher than this is considered high. We have to consider if the pressure measurements are actually accurate. If the patient is squeezing his or her eyes during the pressure measurement, or if there's pressure on the globe, or if the patient is holding his or her breath and doing the Valsalva maneuver, all this can actually artificially increase the intraocular pressure. Okay? So to get a more accurate reading, you should ask the patient to relax, breathe normally, make sure that there's no pressure on the globe, and do about 3 to 4 readings and take an average of the readings. So the optic disc can be assessed using the ophthalmoscope. So optic disc with an increased cup disc ratio of 0.7 and above is suspicious, as there's only about 5% of the normal population with such a large optic disc, large optic cup disc ratio. Asymmetry of cup disc ratio of 0.2 and above between the two eyes is also suspicious. So this hemorrhage can be a sign of glaucoma and glaucoma progression, and if the rim is thinned or notched. So this photograph actually shows a very healthy looking optic disc. The optic disc is pink. Okay? The cup disc ratio is this little central part here. It's about 0.3. We usually count, it's a vertical cup disc ratio that we're measuring. Okay? The rims are all nice and healthy. There's no notch or thinning. And the surrounding retinal vessels are healthy looking as well. This photograph actually shows a glaucomatous disc. Okay? The disc is very cupped and it's very excavated in appearance. Okay? This vertical cup disc ratio is 0.9. You can see that the neuroretinal rims here are very thin, and the vessels, they are bullated in appearance. You can see a very excavated appearance of the disc. So this patient actually has disc asymmetry. In the right eye, it's a very pink, healthy-looking optic disc with a small cup disc ratio of 0.3. And in the other eye, you can see that the cup disc ratio is increased. It's bigger than the other side. This is about 0.5 to 0.6. So this is not normal. Okay, disc hemorrhage. So in this photograph here, you can see that there's a disc hemorrhage at the superior part of the optic disc. And over here, there's an optic disc hemorrhage here. Okay, what about patients with known glaucoma who are already on treatment? Okay, this patient can present with drop-related problems. All glaucoma medications can actually cause allergy as well as hyperemia. And if the patient is having an allergy, they'll complain of itch after using the eye drop. So if the patients present to you like this, you can tell them to stop the offending drop, give them some lubricants, and ask them and refer back to us earlier for us to control the intraocular pressure with other medications. So I'll go through some of the medications that we use in glaucoma treatment. Prostaglandin analogs are first-line glaucoma medications as they cause the most intraocular pressure lowering with the least amount of side effects. Examples of these agents will include latanoprost, travoprost, bimetoprost, and tefloprost. Ocular side effects will include conjunctival hyperemia, and this is very common when these patients first start using these eye drops. We usually tell them to persist, and after a few weeks, the hyperemia does improve. These drops can also cause blurring of vision. Cystoid macular edema, or a collection of fluid in the center part of the retina, this is actually quite rare. These eye drops can cause increased pigmentation of the iris, and this is not noticeable in Asian eyes, and as well as increased pigmentation of the periocular skin. So I'll tell my patients to avoid letting the eye drop come into contact with the skin. It can also cause hypertrichosis and periocular fat atrophy. Okay, systemic side effects are rare, and they include muscle and joint ache, as well as headaches. Timolol is a second-line glaucoma medication that we use. This is a beta blocker, and it decreases the intraocular pressure by reducing the aqueous production. Ocular side effects will include corneal anesthesia, irritation, and blurring of vision. This medication can have significant systemic side effects, such as bronchospasm, Hence, it is contraindicated in patients with asthma and COPD. It can also cause bradycardia and heart block, and hence it is contraindicated in patients with heart disease. Other side effects will include depression, impotence, as well as mood swings. So for patients who are started on glaucoma eye drops, we will teach them the correct eye drop instillation technique, and that includes eyelid closure as well as punctum occlusion. That's pressing the side of the eye after they instill their eye drops for about 10 minutes. This will actually maximize the absorption of the eye drop into the eye and minimize any systemic absorption. So Alphagan is an alpha-adrenergic agent. This is also one of our second-line glaucoma medications. Ocular side effects will include follicular conjunctivitis, allergy, eyelid edema, and dry eyes. Systemic side effects will include hypotension, dry mouth and nose, and fatigue. Carbonate anhydrase inhibitors. So the topical medications will include dozolamide and brinzolamide, and they can cause ocular side effects like stinging, conjunctivitis, and keratitis. The systemic version is called Dimox. We usually give this to patients with acute angle closure glaucoma, as well as if the patients have very high intraocular pressure while awaiting surgery. We don't use this for long term, as they can cause serious side effects, such as hyponatremia, hypokalemia, metabolic acidosis, and Stevens-Johnson syndrome. These medications are contraindicated in patients with sulfur allergy. Hyperosmotic agents. This agent lowers the intraocular pressure by increasing the serum osmolality, hence it draws fluid out from the vitreous cavity. Okay, again, these agents are not used over a long period of time. Okay, so examples of it would be intravenous mannitol and oral glycerol. Side effects include urinary retention, electrolyte imbalance, congestive cardiac failure, renal failure, and oral glycerol can even precipitate a diabetic ketoacidosis, so we do not give this in diabetic patients. Okay. So patients with a previous glaucoma surgery, even if it happens many years ago, okay, and they present with a red eye, please refer these patients to us immediately for us to exclude a serious infection. Trabeculectomy is a very commonly performed surgery for glaucoma. So in this surgery, we actually create a small little channel in the white part of the eye, known as the sclera, so that the aqueous can drain out from within the eye to the subconjunctival space. So this surgery is usually done superiorly. In patients with this surgery, if you ask them to look down, you can usually see what we call a bleb, or rather like a little bubble collection of aqueous. Okay, so this is what an eye post-trabeculectomy should look like. So patients who have developed an infection, okay, what we call blebitis or bleb-related endophthalmitis, okay, they can have an injected eye, and the bleb will be filled with pus, so giving a classic white on red appearance. And there can be even a collection of pus in the anterior chamber. Okay, so common questions that your patients may ask you. Can glaucoma be cured? No. Glaucoma is a chronic condition that requires lifelong review. All glaucoma treatments aim to reduce the intraocular pressure to preserve the remaining vision. Pre-existing vision loss, however, is irreversible. Can glaucoma be prevented? No, there's no prevention. However, early detection allows timely treatment to try to preserve the remaining vision. What changes should I make to my diet or daily activities now that I know that I have glaucoma? So a recent study showed that a higher omega-3 intake may be associated with a lower likelihood of glaucoma. However, this is a cross-sectional study, and further randomized controlled trials and longitudinal studies are needed to confirm this. A healthy, balanced lifestyle is recommended for total well-being, and there's no evidence that lifestyle changes, apart from complying to treatment, affects the progression of this disease. Okay, so in summary, be aware of the symptoms and signs of glaucoma and the side effects of glaucoma medications. Be aware of patients with previous glaucoma surgery who present with a red eye, and when in doubt, please refer these patients to us. Thank you.